So we're going to be looking at bicep and bicep brachioradialis from the supine position with our model here. So remembering that bicep brachii comes up along the humerus and attaches, we can't see this, we can't palpate this up here, but the supraglenoid fossa of the scapula. What we can palpate is just below the clavicle, the coracoid process, where the one of the heads attaches to as well. Okay, the short head of the bicep. We know it comes down and it's going to attach just distally to the head of the radial bone here, okay? So, very simple. We're gonna stabilize up around the shoulder, okay? And we're gonna apply, I'm just gonna try to get out of the way here, but with my hands, but try to stabilize up around the shoulder. And then we're gonna apply a force just distal to the elbow. And again, we can have our model here just resist into, she's pulling into flexion. Very simple to see that pop up. So we can also have them do this and then we can palpate as they're holding, we can palpate that muscle very simply, okay? Brachioradialis, if you recall, comes off the lower lateral aspect of the humeral bone, okay, and attaches to the radiostyloid process of the radius, okay? So this case, we're gonna take our patient into neutral position, okay? And we are going to just, again, stabilize above and below, and we're gonna be close to that. I should be a little bit closer to the radiostyloid process and have her come into flexion. And very easy, I'm gonna get my hand out of the way, we can see the brachioradialis coming all the way up. It comes up above, superior to that elbow joint. That's how we know it's the brachioradialis. If we remember as well, from this component, or from this position, if we want to identify the difference between brachioradialis and the bicep, one is in a neutral position, bicep brachii is in the supinated position, but we could also double check by having our client, and we're just gonna get you straighten your elbow out for me, come into a little bit of shoulder flexion. And again, we can stabilize up around the shoulder, just below the radial head, and get them to push into a little bit of flexion, remembering that we're gonna get a little bit of bicep activation there as well. We're gonna be looking at the forearm muscles, so the extensors and the flexors on the inside of the elbow. Quick anatomy review, right? We have the lateral epicondyle, okay, of the humeral bone on that lateral aspect of the arm, obviously, medial condyle on the inside. If we come down just below the crease of the elbow or the cubital fossa, we're gonna find the radial head, okay, that round radial head. We can feel it really well from the posterior aspect here. As we follow both bones down, we're gonna come down here, we're gonna find the radio and ulnar styloid processes, and then into our carpal bones. Remember our proximal and our distal row of our carpal bones, into our metacarpals, okay, and our phalanges. So what we're gonna do here is we're gonna be looking at our common extensors. They come off, and it's your common wrist extensors, sorry. So they're gonna come off of that lateral epicondyle, okay, of the humerus, and they're gonna attach down here in varying positions into the metacarpals. So when we're testing it, we wanna make sure our client is gonna come up into extension, and with your common extensors, we're gonna be stabilizing just around where that muscle belly starts, up on the medial epicondyle, and we want to just apply a wrist flexion vector to the extension. And again, we're gonna see that all these muscles come out here for us, okay? Exact same thing, but reverse for the medial epicondyle, okay? So we know it comes off the, or sorry, for the common flexor origin. We know it comes off the medial epicondyle. The muscles are gonna come down here. We're gonna get her to give me a fist again for me, and I'm gonna get her to bring her fist into flexion, okay? Again, I'm gonna be here with my opposite hand so we can see on the camera, but I'm gonna stabilize just above that medial epicondyle, and I'm gonna apply a slight extension force at the wrist, and then I can always palpate here because her elbow's not going anywhere, so we don't necessarily have to stabilize it. We can palpate the group of muscles coming from the elbow.